Thank you, Dr. Karishma, for doing this interview with us. Today, we're going to be talking about mindful eating and oral health. So, just before we begin, I'd like to quickly introduce you. You're a practitioner of multi-specialty dentistry with a focus on cosmetic and restorative dentistry, right?
That's right. Yeah,
And
absolutely.
just a quick brief about you. You're also an editorial board member for the International Journal for Dental Medicine in the US and have been invited to speak in the UK at the prestigious British Dental Industry Association, and have also co-authored several internationally published articles by like the World Journal of Dentistry and Asia Pacific Journal of Health Sciences on cosmetic and restorative dentistry. So, thank you so much for taking the time to join us today. Really looking forward to this conversation.
Thank you so much for the lovely introduction.
So, to dive right in, why don't we start with what oral health actually means?
Well, yeah, that's a great question because a lot of times people don't really realize what it is that oral health comprises of. But to actually state, oral health is just a lot more than your teeth and gums. That's something that people are not really aware of, but I think a lot of awareness now is being generated about it. It's also about your bite, it's about your jaws, it's about your joints, it's about your head, neck, and your overall body, because there is a strong association between, of course, your oral hygiene, your oral health, and your body health. So a lot of times, something that's going wrong in your body will show up in your mouth. To just tell you very simply, for example, ulcers, a lot of symptoms such as gingivitis or gum disease, which is related to your cardiovascular or your heart disease. So you see the link is very huge and it's very untapped. So yeah, oral health is a lot more than, your teeth and gums. And it actually talks, it actually includes everything, your general health as well. Yeah.
Yeah, that's really interesting. I mean, it seems like oral health encompasses everything in some ways. So, how can one actually maintain good oral health then?
So I think to maintain good oral health, luckily as children, we've been trained to brush our teeth. I think that's one of the first things we get trained to do as little humans. So that's the first thing, and that's the last thing. You can never stop doing that. So definitely brush your teeth, very well daily, twice rather. It's very, very crucial to actually brush your teeth in the night before you go to sleep, because those 6 to 8 hours, we don't want any food getting stuck in the mouth and then staying and then, decaying. So that's something that's very crucial. Definitely flossing is important because that's not where your brush might reach. So that's something that is, we should incorporate in our daily habits. And dental cleanup is very essential because that not just gives you the opportunity to, check have all your teeth checked thoroughly, but also cleans the areas where we, might not be able to reach, because there are certain areas in our mouth where the brush might not go, or the brush might not be that effective in. So it's very crucial that we do a 6 monthly cleaning. So these are really some of the very basic tips. Other than that, in terms of food, I would suggest definitely the sugar intake has to be lot lesser. Once a day or none would be very ideal. And a lot of water. Yes, a lot of water intake, because that increases salivation. And saliva in itself is like a boon for your oral cavity. More the spit or saliva in your mouth, the lesser are the chances that you might get a cavity. So that's something that, I would suggest. Yeah.
Did not know that. Very interesting. I didn't even realize how water relates to like oral health. I mean, everyone tells us to drink water, but you don't understand like how everything can be connected
It
in this
does.
way.
Very. We
So,
are water babies, and that very strong, sorry, but that very strongly relates, because your saliva production will not, see, a lot of times we are fasting and you'll realize that, oh, my mouth is so dry. So it's very correlated, right? If there's no enough water in the body, no saliva that's being produced, and saliva has medicinal properties. It's also antibacterial. It has fluoride in it. So, which is essential for the mouth to stay in a healthy state.
wow, that's actually really interesting. So how can one actually know if, like, if I brush my teeth twice a day, if I'm flossing, if I do all of these things but I still get a cavity, how do I know, or rather not know, whether I have good oral health?
So that's where your dentist comes in, right? I mean, this is been established as a specialty because it's so vast in itself. Like oral health is so vast, and it's magnanimous. So it's very crucial that we tap that bit of it. And 6 monthly checkup is something that's crucial, irrespective of however you maintain your teeth, because like I said, the correlation between your body health and your oral health is very strong, and a lot of people don't realize that. That's very untapped. Very few people and doctors who actually also are tapping this kind of a relationship. For example, if someone's maintaining their oral health very well but is suffering from diabetes, then it's inevitable that you might come up with ulcers in your mouth, or there might be gum bleeding. Now, if that's something that is self-medicating, then it's going to increase, right? So, which is why it's very important to get an expert opinion, and yeah, that keeps you in check.
So, I mean, you've mentioned a couple of times about sugar, about how oral health relates to other aspects of our body, and that brings me to kind of the heart of this conversation, which is oral health and mindful eating, right? So, from your perspective, what does mindful eating mean, and how does that relate to oral health?
Great. That's a lovely question. And I'm very particularly fond of the concept of mindful eating. Mindful eating is basically developing a relationship with your food. It's as simple as that. And how do we do that? There are three steps. First, chew, chew, chew. You have to chew well. If you're not chewing well, like it's not going to be, it's no use. Like the food, what happens is, if you're not chewing well for whatever reason, probably you don't have a good set of teeth, you have decay in your mouth, or it's just your habit that has been developed over a time. What happens is, all the food that is bulky that goes into your stomach, the acid production is a lot higher. For example, if you're working on a certain project which is not of a larger scale, you'll require more manpower, right?
Mhm.
Inevitably. The similar what happens with the food particles. If there are bigger chunks of food particles in your gut, in your tummy, what happens is more acid is produced. That increases acidity in your body. That's how it can affect your body. It can affect your gut health, and which is why we need to actually chew properly. That's the first step. And second, what I would say is savor your food. When I talk about savoring, it's crucial that our brain registers that we've eaten. So a lot of times what happens is, we might be, for example, talking about emotional eating, which is a contrast to mindful eating. What we do is, we are constantly binge eating. Okay, it's sort of a way to suppress your emotions, and we are constantly eating. We are not only not chewing our food properly, but what happens is, your brain doesn't register that you've eaten something, and that acts like a cycle, because then you're constantly eating, and that leads to weight gain. So you see the correlation between just the act of simply eating and like something as huge as weight gain, which can then lead to a lot of cardiovascular issues, a lot of atherosclerosis, like uh, plaques in your gut, plaques in your arteries, and eventually so on. So first is, of course, mindful eating includes chewing well, which is your dental health, which is your oral health. Secondly, savoring your food well. And thirdly, I would say, is eating with gratitude. That's something that comes to your intention of eating. So if you are eating with an intention that is, of gratitude, and thankful for what you're eating, that's something that automatically, makes the whole process of you eating and following those rituals of like chewing your food 20 times. Every bite that you have should be chewed at least 20 to 30 times. So when you're eating with that intention, it automatically becomes a process that you enjoy. So yeah, these are three steps I would say to mindful eating.
That's so interesting because, everyone says chew, like tells you to chew your food, but I love the phrase of gratitude eating. I like it makes you actually appreciate what you're eating and like savor the taste that you're kind of saying, but also like really think about like what you're eating for a second, and like it's it's a it's a great way of just like looking at or like changing your perspective towards food and like the way we eat. And it's interesting because you said earlier that not being aware of this can lead to cardiovascular diseases and a few other illnesses. And that brings me to my next question really. Can not maintaining a good oral health lead to actual diseases as a result?
Oh, absolutely. I think we've spoken about it a lot, but right now, when we were speaking about mindful eating, we spoke about the mind, mouth, and gut connection. That's essentially what it is, right? Your gut, your mind, and how your oral health is really correlated. When we talk about your general health or systemic health, as we call in the medical terms, 110% bad oral hygiene can result in gut diseases. There is a stark connection between the two. Firstly, of course, we spoke about how mindless eating can actually result in weight gain.
Mm-hmm.
And we know that weight gain is the foremost cause for extreme kinds of diseases, be it, diabetes, be it um, heart disease and liver disease. So yes, the possibilities of diseases are endless when it comes to you not maintaining your oral health or not chewing properly. And definitely, there are studies that say, I have researched a lot on this aspect when it comes to oral health and its connection to the overall body health. And there are scientific studies that say that it could lead to chronic gut disease. If your oral health is not maintained well, if there are bacteria in the mouth, what happens is you're constantly chewing and drinking them, and there is a direct passage from your mouth to the gut, and that can lead to chronic gut disease, and which is also known as gut distress, and which eventually what happens is causes increased permeability, or if I may say that your gut lining is no longer healthy. And that in itself, what happens is the nutrients are not getting absorbed well. So now you can understand what kind, like the possibilities endless. One could end up with something called as Hashimoto's disease, thyroid disease, to liver disease. The possibilities of getting diseases are endless if you're not chewing well or your oral health is not maintained. So yeah.
Really interesting. So I'm curious now because something a lot of what I've heard in the past and just talking to various practitioners is that um, is actually finding a way of being mindful about food, right? So the other side of that is people who have eating disorders, and just to name a few, like anorexia, bulimia, probably the most common eating disorders people know about. And what happens then? What happens if, say, for instance, you have bulimia and you're throwing up your food constantly, or like acid reflux, or you're not eating at all? How does that actually impact your oral health?
Oh, it can have severe implications, to your oral health. Well, in bulimia, again, what happens is it's the mind and the mouth connection, right? The patient does not want to gain weight, and in the process of the same, what they do is they kind of try and vomit the food that they've eaten, binged on rather. So what happens is our gut lining is such that it can take a lot of acid, okay, but that's not how our oral lining is or how our mouth is. So when the person is vomiting, there is an acid reflux, right? The acid is getting out from your gut to your mouth. What happens is over the time it abrades, it starts working on your enamel, and it starts chewing up your enamel. The acid sort of dissolves and eats up the enamel, and that can result to very weaker teeth, yellower teeth over the time, and over the time the teeth start to dissolve. So that's something that we've seen very commonly with patients who are bulimic. Yes, and also a lot of ulcers in the mouth because their oral hygiene is not, your oral area is not such that it can take so much of acid. So that's something that, that can happen. A lot of ulcers, plus your teeth getting abraded over the time. And see, this again correlates us to, the concept of eating mindfully, because in this case, like we know, it's something that is, is sort of a mental disorder, but it has severe oral implications and, complete health implications as well.
Yeah, that's so interesting that you say that, because it's I don't think people think about uh, their food in terms of how it'll impact the rest of their bodies, or just like, um, the how it'll impact their teeth, how it'll impact like their breath or other forms of ramifications. And I'm actually curious though. So a lot of people, who have too much coffee, too much chocolate, too much, I don't know. I've read a lot about how a lot of Indians have acid reflux, even if they're not bulimic. And does that have the same implication as something like bulimia? And if it does, what can one do to solve for it? Like, how can you um, mitigate or alleviate the consequences of this acidity in your mouth?
So you're talking about how acid reflux can also have oral implications, right?
Yeah.
Yes, absolutely. It's no different than, your a person who's suffering from bulimia. But the only difference is, of course, that's being done intentionally when the patient is bulimic, and here it's not in the hands of the patient. So there is a sphincter in our esophagus which controls the acid from coming on the top. But what happens is, over the time, the sphincter gets loosened up for reasons, there could be a number of reasons. One common reason is that we are not chewing properly. So it's a vicious cycle. Yes. So if you're not chewing properly, eventually what happens is, there's something called as a bolus, which is formed. Bolus means ball. And when we are chewing in our mouth, so it has to be of a certain size, the particles in our mouth, for the acid, the right amount of acid to come out in the stomach. When the size of the ball of the food is not proper, what happens is that the acid produced is is in a much higher concentration and quantity as well. That eventually leads to acid reflux, because there's so much acid in in your tummy that it is something that's unusual, and the stomach tries to react to it, and that's how this the acid comes out through the esophagus. So what happens is there's a lot of burning sensation that one might feel, when they're suffering from acid reflux. And that can eventually, again, if the acid enters the oral cavity, like we discussed, it can damage the teeth, it can damage the oral mucosa. So it's a vicious cycle. The first and foremost thing that we need to do is correct the cause. And for that, we need to first diagnose the cause, of course. So we need to diagnose whether it's related to your chewing habit, or it's something that's an extremely gut issue. It's not related to a chewing at all, or it's some sort of an allergy. Food allergies can also lead to acid reflux. So that's something that we need to diagnose and then stepwise take it forward.
That's really interesting how something I've just had so many Indians deal with can at least be alleviated in some capacity, maybe if we just learn how to eat and chew right. It's interesting how our body really connects everything.
Absolutely.
Um, but so if if you're uh, trying to give advice to someone, what are some like tips and tricks you'd say one should practice daily, in addition to the brushing and flossing, um, that we can do and practice to make sure we maintain good oral health, and like make sure in the long term we don't suffer consequences of how just like not chewing properly can have on like your gut, for instance.
True. So yes, to give you the tips, other than the tips that we discussed initially, which was like good brushing, flossing, and check up with your dentist, it's very crucial that you make sure that any kind of crookedness or crowding in your teeth must be corrected. And if there are any missing teeth, they must be replaced, because if your teeth are crowded, if the bite is an issue, or if there are missing teeth, no matter what you do, you won't be able to chew well. You know, even if you're following all the three principles of mindful eating, you will not be able to, because you don't have the equipment for it. The equipment is essentially our teeth, right? So that's something that needs to be in place. Only then, that's the first step to, uh, like having a good oral hygiene, right? So that's the first thing that we need to do, is have corrections of, any kind of issues with in relation to our teeth. The second thing that I would say is food habits. Food habits are extremely important when it comes to maintaining a good oral hygiene. Definitely the sugar intake, like we discussed, should be less. But other than that, it's important to, be using a good mouthwash. That's something that I would suggest, ask your dentist first, because a mouthwash is medicated or non-medicated. That's something that we can only check you up and then be able to tell you, like, what is the suitable mouthwash for you. And that can help keep the bacteria in control. Any kind of bacteria, or any influences that the bacteria or the viruses could have, can be in control when you're using a good mouthwash. So that's something that I would recommend. And otherwise, I would say that it's also important to keep your breath fresh. And that's something that, again, it keeps, it's a cycle. If there are bacteria in the mouth, excess bacteria in the mouth, it could lead to bad breath, and bad breath can lead to excess bacteria. So to kind of stop that, it's essential that we have, we can have chewing gum which is sugar free, and once a day perhaps, or chew on mint leaves, tulsi leaves. That's something that's great. And yeah, also replacing your regular sugar with a plant-based sugar would be a very good, really strongly recommend. Yeah.
So that's actually those are some really good and like easy to use tips, I think. Thank you so much. That's really helpful. And I think like just something as simple as tulsi leaves are something everyone can do, and it's so easily accessible. So thank you again for chatting with us. Thank you for having this conversation, and really looking forward to having a few more with you in the future.